so much. So I want to introduce this next session. It's called Hospital Redux. But what we're looking at is when we're talking about reinventing the doctor-patient relationship, we are also talking about, you know, things that happen in the physician office versus the things that happen at the hospital and the care clinics across the country. So I think this session will be extremely interesting. I'm going to invite everyone up here, and I'm going to, in the meantime, introduce you to the moderator, Dina Maron. She's the associate editor. Can you guys come up on stage? Thank you so much. The associate editor of Health and Medicine at Scientific American, so I think this will be a great discussion. She didn't have a resolution, however, she does hope to see change between the healthcare and patients, and for patients to know more about their own health conditions. So, thank you very much.
I built a podium, so.
Get it?
I think it's got to be connected.
Hi, good morning, everyone. Thanks for joining us. I'm really happy to be here. As Jill just mentioned, I'm an associate editor at Scientific American. I focus on medicine and health, so that's everything for me from nanomedicine to robotic exoskeletons to more and more lately Ebola. So it's nice to be here and talk about something a little different with everybody. So yeah, in the last few days, we've certainly been hearing a lot about the shifting landscape of healthcare and clinical medicine. And with this panel, we're hoping to drill down a little bit more about what that means for the changing relationship actually between doctors and patients. The transformation that's really happening now as domains that used to be really only the realm of your clinician are now more and more becoming something consumers are interested in and something that consumers have access to. With the ability to further quantify medicine for people, everything from knowing how many footsteps they take each day to what their blood pressure is not only changing what we know about ourselves, but actually transforming our behaviors, as our panelists are going to talk about a little bit today. I want to make sure that we're talking also about the new challenges that are coming forth for us. With these new opportunities, also things are really changing on the forefront of what clinicians are thinking about, how clinicians are able to interact in those short visits that they have with patients, and the challenges that really come to the fore about how you can manage more and more data and trying to have a relationship with your patient and further elucidate what that information means in the context of the human that is sitting right before you. So to help us sift through some of these questions, we have three panelists today who are going to dive into what they do and the technologies and innovations that they're familiar with. I'm going to ask each of you, please, to take a minute, introduce yourselves, talk about the technology you have, and what problems you're really aiming to address. Go ahead.
Thank you, Dina. I'm Alex Becker. I'm founder and CEO of QLess. We enable digital communication between patients and healthcare providers to allow just-in-time patient delivery. So patients are no longer waiting in waiting rooms. They show up just in time and fill in schedules in real time to refill cancellations and get feedback as to what the actual visit was like.
Yeah, I'm Jeff Hazelton. I'm the president and CTO of BioLucid. And what we like to say is at BioLucid, we're making health visual. So you hear a lot about digital health. We've been in the business now for about 15 years of creating very compelling visuals so that people can understand scientific topics like medicine. So to be able to really take all of this confluence of data that's being generated and make it make sense to patients in an easy way that everyone can understand. And it's a very effective way, we feel, for people to communicate in the medical space.
And I'm Paul Jansen with Masimo. Masimo is the world's leading provider of the most common measurements that are taken in the hospital setting, which are oxygen saturation and pulse rate. And we do that with a pretty wide scope. Over 100 million patients a year are monitored with our technologies. And we do that because our technologies do something that other technologies don't. They measure accurately when the others fail. And so clinicians trust the measurement, and that's really been the foundation of it. We've used that same technology platform to continue to innovate in many new, first ever non-invasive measurements. So now we can take up to 11 measurements from one single finger sensor. And these, again, are measurements that are typically used in an acute care setting. They're increasingly being used in a chronic disease setting. And now we're here at CES introducing that same hospital-grade technology that may cost several $1,000s in the hospital into something that costs a few $100s that's available to the consumer.
Great, perfect. Thanks for the introductions. I'd like you actually each to talk a little bit more about what setting your technology is utilized in. Paul made it clear that his was in the hospital, so whether or not you see this in the next few years being more and more in the hospital setting or in the clinic, and what the price point would be to try to get at what you're offering.
Sure. So how many of you have been to any kind of healthcare service, doctor's office, labs, x-ray, anything, and not had to wait? I don't see any hands going up. Right, so QLess applies everywhere in healthcare. So urgent care, emergency rooms, doctor's offices, labs, pharmacy, anywhere you want a digital relationship with your patient that starts before the patient walks into the office. You want to start getting information from them before they show up. You want to tell them when to show up. You want to know if they're not going to show up in time or get stuck in traffic. And you want to have that digital relationship with them after the visit to be able to survey them, find out what it was like, and gather the analytics to be able to optimize those visits. So it really applies everywhere. In terms of a price point, so it's funny, we routinely see our healthcare providers go from mediocre reviews to 5-star reviews online on places like Yelp once they launch QLess within the first month. So the real question is, how much is a 5-star review available for all of your patients to see worth? And the answer is the ROI is immediate. Like you get a positive ROI within the first month. It's a no-brainer. That's why we're seeing the triple-digit growth we've been seeing over the last 5 years.
Skip over me because I'm going to set up, but go ahead.
Okay, great. Yeah, so I think historically the measurements that we've used or we've innovated at Masimo have been used in the acute care setting. But I think, to your point, we see different questions being asked. And depending on whether you want to use measurements or monitoring for wellness or fitness or chronic disease or acute disease, really changes what you measure, what's important about what you measure, and what you're willing to pay for what you measure. And so I think the questions being asked in each area are different. There's obviously a different cost equation for someone who wants to measure for personal reasons in their home than a hospital that's trying to prevent that patient from being readmitted to the sickest patient in the ICU that's costing thousands of dollars a day. And so I think as technology providers and technology consumers, we have to be very keying in on those questions, what we're measuring and why, and what makes really a difference in ultimately outcomes and costs.
You all set?
So I'm going to practice what I preach here and just go visual with, showing you the types of work that we do. But this is an iPad application. By making health visual, we're creating these. This is called a living medical environment. So a healthcare professional could use this to go in and show, in this particular case, acute coronary syndrome to a patient very effectively. If they have a thrombus that's erupted, they could actually show the plaque, show the vessel in 3D, go ahead and introduce medication into the equation here, show what that does on a microscopic level. There's a lot of different tools and things like that we create to be able to effectively communicate all of this visually in a way that everybody can understand. So I think in this case, we're beginning to see this being used quite a bit, but again, it's about making that digital health picture visual for the patient.
Great, thank you.
Sure.
Is my mic still on? Okay, I think so. What's really interesting, I think, that both Alex and you just brought up is about patient satisfaction. And we're seeing actually that matters from a monetary perspective more and more. With the Affordable Care Act, we're seeing that government reimbursement now is depending more on patient satisfaction. Literally, they're weighing in about whether or not they had a good experience, and that's factoring into how much money the provider is getting. So with that in mind, in the coming years, do you think that's enough of an incentive for doctors and hospitals to start making more of an investment in your kinds of technologies?
I think it's going to get even more like that. I mean, what kind of industry have you seen where the provider doesn't find out the outcome of the result, right? How many times do you get treated by a doctor, and the doctor never gets to find out if whatever they gave you worked or didn't work? They just don't see you again. that
No
will
news
not,
is good news, right?
unless he died, right?
Yeah.
There's a big difference in outcome. So I think you're going to see that feedback loop being closed with communication that lets the doctor know, and not just the doctor, but the payers know, was this a successful treatment or not? And so that feedback loop requires this digital communication, and I think that's the kind of thing that QLess empowers.
Yeah, I think we're entering this era of the engaged patient. They're not, they're consumers. We have to look at them as patient consumers or customers. They're driving all of this innovation because they're demanding it. They're going online. They're seeing what the conditions, what the other patient communities are saying online. So they're much more educated, and I think they'll come in. And of course, if that metric of reimbursement is attached to their satisfaction, we're definitely going to see these types of tools. No waiting is a good thing. Having the ability to understand a disease and then translate that to your family, makes people much more comfortable. And I think definitely we'll see more and more compelling reasons to use our technology in hospitals and clinics.
Sure. I guess all I'd add is I think what we've learned over looking at the past is that hospital systems is a complex system of delivering care. Physicians have a less complex but traditional way of delivering care. So these changes are not going to come from within. And I think they have to be through leverage, both positive and negative leverage. And we're starting to see that. But I think we're really just at the beginning of it. And ultimately, the biggest leverage is the payers, but we tend to think about that as Medicare or the insurance companies, but the employers pay most of the health care. So I think if employers made a concerted effort for patient engagement, you would see real dramatic change in healthcare providers.
From a business model perspective, I'm really interested in whose job you think it is to bring this knowledge about different healthcare technologies to the actual clinic or the hospital who's purchasing this type of technology. Doctors and clinicians or doctors and healthcare providers have such limited time anyway to try to sift through both the administrative billing aspects of their practices and thinking about their patients. How are they going to find out about a technology like yours?
So yeah, I think it's just going to be, they'll see it being utilized. They'll know it's available. The more that the more physicians, I think, or the more healthcare professionals that are using the technology, saving time, not having to re-explain things over and over again. We've seen numerous examples, coming out of medical animation, which is where, the company originally was founded, and, there's, medical animation being used all the time, and physicians love it because, if it's a product that they're using in treatment, they could basically hit a button and hit play and let the patient see it. And they get just a much higher level understanding, and they don't have to be talking all the time. So I think, it becomes a matter of, the physicians of the present and future understanding the value, and that's how it'll proliferate throughout I think the industry.
There's so many interesting consumer-facing health technologies in exhibit here. And I think you want to get those to the patient before they get to the doctor, because in many cases it's things like the device you were just showing, which can be in the patient's hand before they show up to the doctor, or it's remote health monitoring so that they don't need to show up to the doctor. So I think you want to see them exposed to the patient before they make the decision to show up at the doctor. So that's why companies like QLess are partnering with people like iTriage and all sorts of other medical providers, and institutions like Cleveland Clinic and Renown Healthcare and NextCare to get these tools exposed to the patient before they even show up.
With this greater interoperability and the fact that more technologies are online, you're sharing more information remotely. Paul, maybe you can speak to this. I'm really wondering more about the security concerns. The Food and Drug Administration and U.S. Homeland Security in the last couple years have been talking more and more about this concern about hacking medical devices. Not even necessarily from a nefarious perspective, just malicious malware isn't discerning what's got bank information and what is a radiation machine or a remote sensor. How can we better protect ourselves and these systems?
Sure. Well, I think when you talk about security, then I'll talk a little about connectivity, but security, of course, has to happen at each of the different layers, whether it's at the device layer, there has to be built-in securities within the infrastructure, and then it has to happen at the system and enterprise level that prevent those types of things. But I think those are minor issues and that tend to get a lot of energy put around them. There's a bigger issue. The bigger issue is, in spite of all the talk of interoperability and connectivity, which I think is present outside of the hospital in the home. It's increasingly happening in the physician office. It's a real challenge in the hospital. And it's not because standards aren't available. It's not because devices aren't capable of communicating. It's that a lot of companies don't want to share the data from their devices in a free, unfettered way because they see it in their business interest to contain that information, package and put it back. I think there's a new approach emerging, though, which is that open source, open access to device information through secure protocols that allow any system and any device access to the information in other devices. And that way, companies can provide the best of breed measurements or therapeutic systems. They can also develop systems that aggregate information, but they don't use it, their own devices, as a roadblock to other companies because that impacts patient safety in a negative way. So we see that as a tide that's changing significantly over the last few years. And Masimo's been at the forefront of that, and challenging medical device makers to make a pledge for something pretty simple. We'll make our data available to other companies and other devices that ask for it. But not all companies have joined on. So we encourage all med tech companies that operate in the hospital space to make that pledge.
You were asking who pays for these things, and I think we'll see increasingly more and more different parts of the ecosystem pay for it, right? So in the case of a technology like QLess, on the one hand, the insurers benefit from the reduced contagion that happens in waiting rooms, which is the best place in the world to get sick. And so they have an incentive to get whitelist waiting rooms. The doctor's offices or the healthcare providers benefit because when you get a technology that has 80% conversion rate of anybody who uses the widget on the website to actually show up offline at the clinic, then that brings huge returns. It's 20% year-over-year increases in patients. And then on the other hand, you have employers who, every time somebody is spending an hour waiting for, I just got an email yesterday from my head of marketing saying I'm not going to be at the call today because I'm waiting at the doctor's office. Right? Well, that's lost productivity for the company. And when you add that over the life of the employee and the whole company, it's millions of dollars. And so I think you're going to see employers demanding that from healthcare providers and their clients too.
So yeah, I think we're excited to see these ecosystems emerging. Like a lot of big players getting into the pooling of this data. So with Apple Health Kit and Google Health and Samsung S Health, to have APIs available for developers to plug into to be able to share all this data to make it more open. Because if it's all of these proprietary devices and nobody's talking and pulling this data together, then I don't think we're going to get very far. So I think it's great to see that security. There's a lot of different ways that we can address that, but obviously with the resources of those companies, we can address that issue. So I think it's an exciting time. The last couple of years has been a lot more of that introduced, and I think to see more and more of it and how that ties together to get people a complete picture of their health is really important.
In the pages of Scientific American, we actually just wrote an issue about how we're sort of running the biggest health experiment right now than we ever had in the past, and that no one's sort of at the steering wheel in terms of people quantifying more medical information about themselves voluntarily, and that this information, it's sort of unclear who it belongs to, where it will be going in the future. Are we missing an opportunity by not having a central entity, collecting all these metrics people are putting forward? Where do you see that going in the next couple of years, and whose responsibility might it be to try to harness some of that information?
I think that you're going to see the same thing happen in healthcare that has already happened in every other domain. If you ask the millennials and young people out there about privacy, they'll say, privacy? What is privacy? What are you talking about? So with healthcare, as soon as the benefits become clear of the big data explosion's impact on prevention of disease, and when people see that they can choose to have private information or they can live for 20 years longer, they'll choose the 20 years. I think that's coming for sure.
Yeah, I think, in this age, we're entering the age of the quantified self. So it's, really the patient has to own all of that. The consumer patient has to own all their health data. And I think, to see that, we can go and we can get scans done, and I think it's in the past been strange for patients to ask for and receive that data. But I think, from now and moving forward into the future, we really have to be responsible and the holder of all of that information. And that's really where I think I see that, Health Kit and some of these other products coming out where, you actually have a way to collect all of that information, and then providers have to make that available to patients. And once that becomes normal, then I think we'll see definitely you should own your own health data. You should be the record keeper of that and utilize it.
Yeah, I agree with those things. I think it's a little different if the patient initiates the data capture as opposed to the healthcare provider or healthcare entity initiating the data capture. And I think it goes back to the continuum I talked about, whether someone is really focused on wellness or personal management of chronic disease condition like hypertension or diabetes. That's different than if they're a high flyer for hospital readmissions and the hospital with increasing incentives and disincentives wants to keep them out of the hospital and may deploy technology. And so who owns it and who uses it, I think, differs depending on the scenario. But back in the first situation where the patient is increasingly quantifying things, I think you see a shift, but doctors aren't so easy to adopt this shift of, hey, doctor, I'd like to email my results from this device that I purchased online and tell me what you think. Well, there's no payment mechanism for the doctor to receive reimbursement for that. So a reflexive answer of that by a lot of physicians is, I don't want it, I'm not going to deploy that channel. I think that's going to have to change because they have to really look at the more holistic management and communication of the patient as opposed to these intermittent once every few months connections with the patient. But not all physicians are there to embrace that yet. But I think that'll change.
But I think the sharing will go beyond patient to physician. I mean, companies like 23andMe are already making the sharing of genetic information provide valuable insights to the patients from the patients. And I'll give you an example. A few years ago, I had some scaling in my skin in my hand, and I went to a dermatologist, two dermatologists. They had no solution, no answer. Then I was a student at Caltech at the time, and I went to the Red Door Cafe, and the barista looked at my hand and said, oh, I had that. Just stop using the soap. It's the soap. I stopped using soap, and sure enough, I never had it again. That kind of sharing will happen in a much more systematic way. You won't have to find the right barista. You will find people who have your same symptom and find what worked for them before and find people who have the same genotypes as you so that that's more relevant to your case.
The first word that jumps to mind from your responses for me is trust. How a clinician would know whether or not to trust that data that's coming in. Sure, I may have an app that's been looking at my heart or my sleep patterns or my footsteps, but a different app might have said something completely different. My walking count might have been 100 for one thing, and it might have been 150 according to another count. So do you think that some of the resistance from clinicians might be, I'm not familiar with this app, I don't trust this information, I'm used to a more periodic cull of information, not this continuous information, I don't trust it, / I don't know what it means?
Yeah, I think there needs to be a solution initiated at least, because I think right now, not a lot of, it's a minority of patients that are coming in with this type of data and expecting it to be used in their care. But I think we're going to see more and more of that. So it should be addressed earlier on, as it's going to be much easier at this point to filter. So for example, do you trust an app like that, or do you go through a list of curated apps that are going to be accurate? Or how do you weigh that data versus your actual lab results, something like that. So there needs to be some kind of a process, I think, put in place, and it would be advantageous for the medical community to understand that now, while there's not so many patients that are coming in, as opposed to in the future when it's this flood of patients that now they're having to find a solution under those circumstances. So I think it's important for us to address those questions now, and that's a big question. I agree.
I think after the incentive issue that we've talked about, trust is a big issue. Relevance is also an issue. So I think there are, frankly, a lot of things being measured that the physician would say, what are you measuring? Why? And because the criteria that's used, for example, by a hospital to decide to deploy a new measurement technology is dramatically different than, say, even a physician might in their practice versus what a consumer might. And the questions they ask are a lot different about the fidelity or accuracy of those measurements. So I think the trust factor really goes back to both of those things. Is this really important in what you're setting out to do? And if they're smart, they'll engage in that discussion with the patient. But then also, which type of technologies are you using? And I think in this connected world, those that can really be trusted are the ones that will rise to the top.
Interesting.
Eric Herring, my first VP of engineering, once told me that trust consists of three things: disclosure, interaction, and flexibility. In distrust or mistrust happens when you don't know enough about something. In the digital age, I mean, every one of the devices out there in the hall is a device to collect some new sort of measurement and put it out there to the world. So we will have so much more information about every one of these devices and about every one of the providers than we ever had before. I mean, what Yelp is doing today is going to be multiplied by many orders of magnitude. And so I think trust will be much easier to have because you'll have reputation scales online, digital, that will allow you to know immediately of the, of the 30 million people who use QLess so far, 99.9% of them loved it, therefore I trust it.
I see we're running low on time, so I want you all to dust off your crystal balls for me. And I'm interested in, from your perspective, from 40,000 feet and from the front lines of where you're interacting with your consumers, where do you see this field going in the next 5 years? And what does that mean for doctors and patients interacting together? You want to start, Paul? Not to put you on the spot, but I will.
Sure. Well, I think we're going to see a continual evolution or breakdown of the silos. And what we're going to continue to measure is going to change, who can measure it, and how that information is communicated. So I don't think we're going to wake up someday and say today is now dramatically different. It will occur over time. And frankly, I think a lot of a friend of mine said to me, a lot of what we're seeing right now is like, internet in 2000, where there's a ton of companies, there's a lot of energy and commotion going on. And in the end, when the dust settles 10 years later, 10% of those companies will be around because they provided real value. And that's where I think we all need to focus. Is where's the real value as opposed to just the motion and commotion?
So yeah, I think we're definitely in a time now. We're exponentially sort of evolving on this idea of being able to collect data. I think data is where the focus is right now. But in the future, I think we're going to have to make sense of all that data, and we're going to have to make it relevant to patients and their care. And so we're dedicated to try to make sense of that in a clinical way. Using this, our technology in the clinic is important to do studies to understand. Is this higher level of patient engagement helping with outcomes? And I think that's where we really need to focus. And once we start seeing results like that, then I think the rest of the community will be more receptive.
I think there will be three primary trends that will drive this. Globalization, personalization, and consumer-centric. So on the globalization front, just like TED Talks and the fact that universities like MIT are putting their courses online for the whole world to see for free, makes any student, no matter where they are in the lowest part of Africa, they can still get access to the very best professor teaching the very best course in the subject.
Assuming they have internet.
Assuming they have internet, which is one of the things that will happen. Everybody will have internet, or 90% of them will. So that same thing will happen with medicine. Today, you are stuck with your local doctor, whether he's good or bad. Tomorrow, we will all have access to the best treatment for each, not necessarily in treatment, but in information, right? The information will be there. Information will be commoditized. And so if there is a leading expert in one particular treatment, everybody will have access to that information. That's the first one. Second one is medicine will be personalized, right? So I will have access to somebody who is just like me, just like the barista had my same problem, to be able to find what actually works for me rather than just in the average case in the textbook. I think the third is the consumer will be king, right? So the consumer has a choice, particularly in a global world with digital technologies that allow you to choose globally. The consumer will be more king than ever before. And so just like when Apple approached us a few months ago and said, hey, we've just experienced QLess at a QLess establishment. It's the best customer experience we've ever had. We want to have this. And it happened very quickly. Within 2 months, they had deployed it. So the same thing will happen. People will need to have consumer-centric technologies to really care because the rest will disappear.
Well, thank you all for the really great discussion. I think it's really interesting. I'm hearing more and more from this panel and the ones that happened earlier that we're certainly in a time of transition and excitement. So I'm looking forward to see where it's going. Thank you so much.
Thank you.
Thank you. Thank you.